Good afternoon, everyone. My name is Juliati, and I am a community pharmacist working within Watsons. First of all, Happy Chinese New Year for those who celebrate it, and hope this New Year's brings all of us good health and lasting prosperity. Welcome to another session of Watson's Facebook Live, Ask Our Pharmacist. Today is the second session of Watson's Facebook Live in 2021. If you would like to listen to our previous sharings, feel free to check them out under the video tab of Watson's Facebook page. For today's Facebook session, I'll be discussing about gastric pain and reflux. This is a very common occurrence during this festive season of binge eating. I will share about what is gastric pain and reflux, also medically known as gastroesophageal reflux disease. How does it come about? And ways to prevent and also manage the gastric pain and reflux, and lastly, when to seek immediate medical attention. If you have any questions along the way, feel free to leave them as comments, and I will try my best to answer them at the end of this sharing. Gastroesophageal reflux disease, also known as GERD or GERD, is a digestive disorder where the connection between the stomach and the food pipe, also known as esophagus, is unable to close properly and allowing the food and the acidic content to flow back into the esophagus. In a normal digestion, this connection, which is a muscular ring, actually opens to allow food to pass through from the mouth into the stomach and closes to prevent the food and acidic content to flow backwards into the esophagus. But when this connection muscular ring becomes weak and faulty, food and acidic content can actually flow backwards in esophagus, resulting in GERD symptoms. Constant reflux of this acidic content into the esophagus can irritate and sometimes damage the lining of esophagus, leading to a more serious complications. So you'll be asking, why does this GERD happen then? So there is really no one single cause for GERD, but there are certain factors that may increase the risk of someone getting acid reflux. First one is old age. It is true that prevalence actually increases as we age. Second, being obese. This is because it actually put a pressure on our stomach. Third one is pregnant. It's because of the hormone progesterone that cause the relaxation on the muscular ring. Fourth one is smoking. Smoking increases the stomach acid and also reduce the function of the connection ring. And the fifth one is irregular dietary intake, with certain foods and drinks being more prominent, such as fatty and spicy food, alcohols, chocolates, caffeinated drinks, such as your coffee and tea. Use of certain medications, including asthma and heart medications, certain painkillers and sedatives or sleeping pills, as well as antidepressants. And lastly, anxiety and stress can also increase the risk of getting acid reflux. If the GERD symptoms occurs 2 times or less in a week, we call it as a mild and infrequent occurrence. In this case, initial management will be mostly placed on a lifestyle modifications and also triggers avoidance to manage the GERD symptoms. If initial management is not sufficient to manage the symptoms, medications are usually added to better manage the condition. So some lifestyle changes that one can adopt to improve the GERD symptoms, also to prevent the occurrence of GERD, includes first one, eat regular meals. Second, avoid overeating and instead eat small frequent meals and avoid lying down immediately after meals. Third one, if there is a nighttime symptoms, avoid eating 3 hours before bedtime and raise the head off the bed. Fourth, if you are a smoker, you should consider quitting smoking. Fifth, maintain a healthy weight through exercise and proper dietary choices. Remember to avoid certain triggering foods and drinks. Avoid medications that have a direct irritant effect on the gut. If they cannot be avoided, consider take it after meals and with plenty of water. Avoid tight-fitting clothes as it can put pressure on our stomach. And lastly, we should learn to manage the stress better. As I mentioned, if lifestyle modifications is not sufficient to manage the symptoms, medications will be aided to better manage the condition. First one is antacids. As its name suggests, antacids neutralize gastric acid and is usually given as needed basis for unpredictable symptoms. They commonly contain aluminium and magnesium hydroxide, calcium carbonate, sodium bicarbonate with or without simeticone for bloating. Second medications are alginates. When react with our saliva, alginate will form a foam barrier that floats on top of our stomach to protect esophagus from the gastric acid. Just like antacids, alginates are usually given as needed basis after food for unpredictable symptoms and can be easily found over the counter. Third medications is histamine 2 receptors antagonist or H2RA. H2RA reduces gastric acid production by blocking this histamine 2 receptor activity and can be bought from pharmacy for limited sale without prescription. Example of H2RA include famotidine, ranitidine, and cimetidine. If the gut symptoms are predictable, for example, if you consume a large meal and then you have a gut symptoms, H2RA can be taken 30 minutes to 60 minutes before taking the large meal. And the last medications are proton pump inhibitors, or the short form is PPIs. PPIs like omeprazole or pantoprazole can be used to reduce gastric acid productions and also allow healing of the gut. PPIs can also be bought from pharmacy for limited sale without prescription. They are usually given if symptoms persist despite taking antacids, alginates, and H2RA for 2 weeks. If required, PPI is usually given once a day, 30 minutes before food. Although majority of the gut symptoms can be managed through lifestyle modifications and medications, persistent and severe gut symptoms should warrant the need for further investigations and doctor consultation. It is therefore important to consult a doctor if you have these following alarm symptoms. First one, if you have persistent symptoms for more than 2 weeks despite self-treatment. Second, if you have moderate or severe symptoms 3 times or more in a week with significant impact on your quality of life. Third one, if you have heartburn that's accompanied with fever, headache, nausea and vomiting, especially if the vomit has blood in it. Have shortness of breath, wheezing and also hoarseness of voice. And lastly, if you have pain during swallowing, difficulty swallowing, chest pain, unexplained weight loss, bloody stools and also yellowing of the skin and white of the eyes. To sum up, it is best to seek professional help early when you develop gut symptoms to avoid delaying any initial treatment. We have come to the end of this sharing, so now let's take a look at the comment section to see whether we have any questions. It looks like we do not have any questions at the moment, but probably I can share some of the questions that is commonly that I receive regarding this GERD. First one is some people will ask, can I take dairy products or milk when I have GERD? There's really no direct link between consuming dairy products and acid reflux. However, because high-fat dairy products such as whole milk or yogurts, they are usually digested more slowly and can and stay longer on the stomach, they may potentially increase the risk of getting acid reflux. So if let's say you suspect that you consume dairy products and cause you to have acid reflux, you may consider to change the whole milk to oat milk, soya milk, or almond milk that is have a lower fat content. The second questions that are usually being asked is, can probiotics help with gut symptoms? Probiotics are very common nowadays, and we know that it's help with our digestions and help to protect against harmful bacteria. However, there is no robust evidence to show that there is a effect of probiotics on the acid reflux. If you are already taking probiotics, I would say probably there's no issue to keep continuing taking it. But if you have not and if you are experiencing acid reflux, I would suggest to try to modify some lifestyle that could be potentially causing the gut symptoms. And the last questions that I'll also commonly receive is, there are so many medications over the counter, especially like antacids. How do I know which one are more suitable for me? When you look at the options of antacids, some of them contain simethicone and some do not. Simethicone actually helps with bloating, so if you have bloating, maybe you should consider getting the one with simethicone. And some of and the onset of actions is actually faster with liquid types of antacids as compared to the tablet type. But if you already have a tablet one on hand, you can consider to chew or for a quicker relief of symptoms. As I mentioned, antacids usually contain aluminium, magnesium, and calcium carbonate, sodium bicarbonate kind of salt. So there are certain side effects that may be associated with one but not the other. Aluminium and calcium containing antacids can cause constipation, whereas for magnesium containing antacids can cause diarrhea. So these potential side effects can actually help you to choose which are the antacids that are more suitable for you. We have come to the end of the sharing. I hope that you have learned something and enjoyed this sharing. If you have any more questions regarding gastric pain and reflux, you can leave them as comments, and I will be here for the next 3 hours to address your queries. Thank you and have a nice day, and I'll see you at the next session. Bye bye.